I'm Joseph, a psychiatrist working at Epsychiatry, a telehealth mental health service provider. Welcome to our YouTube channel. If you have been diagnosed with PTSD and you identify with the label, I would recommend that you see a psychologist and or a psychiatrist with an interest in PTSD. In this video, I'm going to discuss how a psychiatrist can help with PTSD. There are timestamps here if you would like to skip ahead. PTSD is not a simple diagnosis to make. There is overlap between PTSD, anxiety, substance use, and depression. There is a high degree of comorbidity between PTSD and other mental health diagnoses. Getting the diagnosis right is important as it impacts on treatment. Psychiatrists can provide both therapy or talking treatments plus medication scripts. The go-to treatments for PTSD currently are eye movement desensitization and reprocessing (EMDR) and trauma-focused CBT. Both of these talking therapies you can see a psychiatrist to receive. Sometimes you need medication for the treatment of PTSD. Antidepressants, in particular SSRIs, which are a class of antidepressant, are usually the first medication treatments trialed for PTSD. Your psychiatrist can start you on antidepressants, adjust the dose, and monitor for side effects. Depression and anxiety presentations overlap with PTSD diagnosis. Your psychiatrist is well suited to explaining to you how these diagnoses impact upon each other. Treating drug and alcohol misuse or dependence. As mentioned earlier, people experiencing PTSD might use alcohol as a way to cope, to help reduce hypervigilance and arousal they are experiencing as part of their PTSD. This alcohol use can lead to negative physical health outcomes plus have wider impacts on the person with PTSD and their family. Sometimes people with PTSD need hospitalization. It could be due to self-harm thoughts, worsening mood symptoms, stresses to their supports, or just being unable to cope in the community. Psychiatrists can admit and manage your care in both public and private hospitals. Connect you with supports. There are various peer support groups, both local, national, and online. Your psychiatrist can explain to you how peer support can help and point you in the right direction. In Australia, a psychiatrist may help with getting various government supports plus provide legal reports. Finally, they can refer you to other health professionals. They may refer you to trauma counselors, psychologists, or social workers who can provide you with targeted interventions to help with your trauma. That brings us to the end of this video. We have a whole series of videos on PTSD, including ones on PTSD complications and factors that contribute to PTSD. You can learn more about PTSD by visiting our website. Thanks for watching.